All right, so I want to talk a little bit about some fundamentals of standing practice in internal arts. So I made this little cardboard springy thing, and to illustrate what I think is one of the most essential concepts in standing practice. So especially in the Chinese internal arts, you can see this is a very tangible way of experiencing yin-yang theory. So yin comes first, yang comes second. So you need to be able to release before contracting. You need to be able to experience down before experiencing up. And that is why I think standing practice is such an essential component to a myriad of arts, especially Neigong and Qigong, is because this standing meditation practice is teaching you some fundamentals of anatomy and motion and all of those things. So back to this. So this, it's feet, knees, hips. So one of the things that is essential to experience, let's see if I turn it that way, that's better, is that you want to feel how you can relax your joints and allow gravity to essentially move them like this. And that you don't do it to yourself. If you pull yourself down into that position, then it's going to create all sorts of tension and stress in the joints. So what you want to do is position yourself in such a way so your spine is in axis and you feel how gravity essentially is doing this to you. Okay, so if you look at how it looks in practice here, so maybe I'll turn to the side so you can sort of see a little bit better. So I bring my spine in axis, so it's, I just mean it needs to be as upright as possible. And from here, I relax my, all at the same time, just relax the ankles, the knees, and the hips, and allow gravity to shrink you, almost like it's going like that, but without taking the spine out of axis. And so what that ends up happening is, as the ankle is dorsiflexing here, you're going to find that you get to an end range, because if you're keeping your heels down, your Achilles tendon can only go so far. Okay, and so your sort of range of motion here is going to be dependent on how mobile and flexible your ankles are. So your ankles really determine what the end range of this is going to be. And so you, again, like I said, you're going to bring your, find that end range with your ankles. And you'll find, because our feet are much more complex than that little piece of cardboard, is that you have this round talus bone. So on here, as you're coming down, you're going to be bringing those pressures more to the inside. So as you dorsiflex the foot, it begins to pronate. So you're going to feel that bone, the talus bone, start to move a little bit in of center, and depending on how wide your feet are, then they're a little bit wider, it's going to go more. But as you're coming down and relaxing the ankles, they come into dorsiflexion, the foot starts to pronate a little bit, and again, there's variability across structures, but that's the general way it's going to go. So you're going to feel a little more in the medial half of the foot than you are the lateral half. And then as you allow it to come even more, you'll start to feel the weight more in the front part of the foot than the rear part of the foot. And you can see that my pelvis, this is the hardest part for people because we hold so much tension through the lower back and the pelvis. So if you look kind of from just watching my pelvis, so from here, if I soften my ankles, knees, and groin, my pelvis starts to anterior tilt. But it does it in a passive way. There's nothing in my back that is contracting at all. But as I soften my pelvis to keep my spine upright, then the pelvis is going to anterior tilt. And these hip flexors are nice and soft. There's length through the spine. And so you end up finding whatever your end range is. And so this is what is, I consider coming into the yin channels of the body. And so you come into it through softening and somewhat passive. You almost kind of fall into them, finding that end range. And from there, you begin to do an active motion out of the floor, out of this full compression. So from here, you're allowing everything to passively lower and then begin to press slowly with the feet, and you'll start to come out equally from that folding. So you want to try to have it be even. So having your ankles, knees, and hips or pelvis come in the same speed and the same rate coming out of that passive relaxation, until usually you get to around 60-40. And that this can be, you know, you can kind of come in and out of it. So it is somewhat of a breathing motion. But approaching it this way can help take a lot of tension out through, especially the pelvis and the ankles. And so anytime you start to feel, oh, I'm holding and gripping a lot in my ankles, then you can come back, relax, reset, and then come back into a more like that classic 60-40 position where you're feeling, you know, whether you use the more symbolic language of sinking into the earth and lengthening into heaven. But the first thing that has to happen is that gentle folding of the joints. And this is where I've seen so many things go wrong, is that people force themselves down in there and they get into the sinking by tensing things, and you want to have it be as relaxed as possible. And this helps you understand a little bit, I think, about kind of the difference between the yin channels and the yang channels. And it becomes more, I guess, obvious when you're on one foot, because they do engage. But when you're in your feet bilaterally, you're able to really just sort of enjoy this relaxation, because eventually you find an end range, and because you have the two legs, they're able to kind of support you with very little effort in this position. What's trickier is when you come onto one leg. And so when you're on one leg and you start to relax the joints, this is where you can start to sort of see where there are sort of weaknesses or deficits or imbalances between the yin and yang channels of the body. Because this is when you're on one leg and you're relaxing and finding that nice end range with the hip, the knee, and the ankle. That's when you don't have that other leg to stabilize you. You don't have call it like being like in a ladder. And so here is where you'll start to feel, what is the structural integrity of the yin channels of my legs? Because this is where they really show themselves, is how well you're able to stabilize on one leg. And so I say that more just because sometimes when you're learning about the yin channels, that it's not always clear what their strength is, right? Because when you're here, it's like, okay, I get there by passively relaxing, letting gravity move through me, and sort of the strength aspect or the stability aspect of the yin channels isn't as clear. And where you really see it is when you are on one leg and you create that softness through the joints, and you find, well, what's going to create that stability so you don't go? So they're kind of like the stopper, because if you didn't have that, it would just fall over like that. And that's where you see, you can really clearly identify pathology that's coming from yin sinew channel deficiency, is if they're able to come into that lengthened, softened joint position, and how well they're able to stabilize through the inner aspect of the leg.